Good afternoon, all. I am Advait Lele from on behalf of Hetero Healthcare. Coordinating invite you for today's webinar on low-dose oral minoxidil and its role in trichology. Today we have our honorable speaker, Dr. Samkit Shah from WAPI, and Dr. Shah is having a rich experience of more than 15 years in a clinical as well as uh, cosmetological dermatology. He has expertise in hair care, treating the hair care disorders also. So without wasting much time, I request Dr. Shah sir to guide us on low-dose oral minoxidil and its role in trichology from his perspective. Over to you, sir.
Thank you. Thank you for the invitation. Uh, so can I share my screen?
Yes, sir.
Is the screen visible?
Yes.
Okay. So good evening, everyone. We will be talking about low dose oral minoxidil in trichology. Although it's not a very new thing, it's been there in the market since 3 to 5 years now, and many dermats have already started using it, but still many are hesitant to start using it in their practice for alopecias. So the main understanding of why we need oral minoxidil is uh, first is many people find it easier to take than applying the foams or liquids. Second thing is we all know there is something which is called as the conversion of minoxidil once it is absorbed. So most of the times what happens is that even if the patient is applying minoxidil on a regular basis, the patient is not getting the desired results because of two things. One is the absorption doesn't happen because of the different carriers which are not working in a proper way. Second is sometimes patients develop seborrheic dermatitis or scaling or flaking in their scalp with minoxidil lotion and then they stop applying it. So to improve the adherence, improve the compliance, oral route is far more better to get the desired results. Next comes there are multifaceted actions like minoxidil works through vasodilatory action. It stimulates the ATP sensitive potassium channel. It stimulates vascular endothelial growth factor release, activates the vascular endothelial growth factor related beta catenin signaling. It also works as anti-inflammatory agent by reducing polyfollicular microinflammation by inhibiting various inflammatory mediators. It also acts as anti-androgen by reducing the expression of 5-beta reductase type 2 gene in human keratinocyte cells and enhances the synthesis of DNA in the anagenmal. Pharmacokinetics absorption is rapid and almost complete with peak serum levels in about 1 hour. It has a low protein binding, so it's widely distributed. Primarily metabolized in liver to minoxidil O-glucuronide with only about 10% excreted unchanged in urine. Elimination half-life is approximately 4.2 hours. So within 8 to 10 hours, the most of the drug is removed out of the body. The active metabolite may accumulate in patients with renal implant. It is often used for hair loss at a low dose, that is 0.25 to 5 mg, but is FDA approved for hypertension at higher doses. A patient can take oral minoxidil in a fed or fasted state. Food does not impact the bioavailability of oral minoxidil. So indications, androgenetic alopecia, it's effective for both male and female pattern hair loss. Other disorders mainly are used for chronic telogen effluvium, lichen planopilaris or alopecia areata. Dosage in male, it should be usually initiated with 1.25 mg per day. It can be increased to 1.25 mg every 3 months up to a maximum of 5 mg per day. In female, initiated with 0.625 mg per day. If needed, dose may be increased every 3 months up to a maximum of 2.5 milligram per day. After initiation of low dose oral minoxidil, visible hair growth may be seen after 3 months. If there is no satisfactory response after 3 months, consider updosing. The most important thing before starting oral minoxidil is every patient should be asked a history of hypertension, should be asked a history of any cardiac disease, and if you have any susceptibility that patient might be suffering from any cardiac disease, always get a ECG done. Because if any individual has any ECG abnormalities, it's a contraindication for oral minoxidil. Clinical evidence. There are multiple studies which have shown the efficacy and safety of oral minoxidil in treatment of alopecia. So, what are the side effects and contraindications? The most common is hypertrichosis. Second is temporary fading. A transient increase in hair loss often occurs in first 2 to 6 weeks as old hairs are pushed out for new growth. Cardiovascular symptoms, they are rare at low doses but may include lightheadedness, fluid retention, headaches, or a racing heart. Contraindications, it should be avoided by pregnant or breastfeeding women and those with a history of certain heart or kidney condition. Monitoring is usually not recommended. Monitor only in case of patients taking antihypertensive medications at the start of treatment or if the patient complains of symptoms. Warnings and precautions, consult a cardiologist before prescribing low dose oral minoxidil to a patient with a history of heart disorders, particularly in the elderly individuals. These are the two strengths available, 1.25 mg and 2.5 mg in a scored form. So for females, if you want to start at 0.625 mg, you can break the tablet into two pieces and then start. And for males, you can start directly with 1.25 mg or go for 2.5 mg half tablet and then increase the dose as per your requirement. Thank you. Please feel free to ask any questions
Yeah.
regarding oral minoxidil and we
Eh,
can continue the discussion.
Yes, sir. Actually, Major, first of all, it was a very nice presentation, sir. You have very crisp way you have mentioned the very big points and very crystal clear communication so that everybody has understood by now. So for convenience of the audience, I have compiled the questions. So just sharing you the questions one by one. Coming to the first question, sir. In which type of patients do you prefer oral minoxidil? It means any age-wise or gender-wise categorization do you do while prescribing oral minoxidil?
So two things. First is, if we get a young patient, let's say around 20 to 30 age group, and patient has already used topical minoxidil and has not achieved satisfactory response, or has stopped using minoxidil because of multiple side effects from topical lotions, then in those cases we start oral minoxidil. Second is for females, wherein patient is already applying topical minoxidil where we are not seeing satisfactory results even after 3 to 4 months of constant usage, then we shift them to oral minoxidil.
So basically, depending upon patient condition or I would say the patient response, the call has to be
Mhm.
taken whether it has to be shifted to oral or not.
Yes, absolutely
Right.
correct.
So moving ahead, sir, is the treatment initiated with either oral as a standalone or topical as a standalone or both as a combined?
So let's say if it again depends on the severity of disease, it also depends on the category of patient and the intent of patient to get desired results. If I have a 22-year-old boy who is already going from grade 3 to grade 4, I would start both oral and topical. I would want to attack through both ways. I would want to also have topical formulation reaching the hair follicles as well as oral formulation reaching that area and allowing a sufficient dose of minoxidil to reach their area and inhibit the actions. Of inflammation and increase the vascularity and increase the anagen phase. Let's say if a person is already applying topical minoxidil, not having side effects, but not getting result also, then in those cases, I would not stop topical, but I would initiate oral and then slowly over a period of 3 to 6 months will wane off the topical and just continue oral. So it all varies on depending on the severity of disease, depending on age of the patient also.
Right. So definitely, sir. But as you mentioned rightly, it depends upon the age and severity of the patient. But when the choice comes to you, whether you preferred oral minoxidil and topical minoxidil together, or oral minoxidil and serum-based formulation as a combination.
If, as I said, if the severity of disease is very high, like if someone is having a grade 3, grade 4 at a very young age, I would continue with topical and oral minoxidil both. We nowadays get many topical minoxidil which come in combination with Redensil, Capexil, so that would be preference. However, if someone is developing side effects with topical minoxidil, then I would shift them to topical peptide-based serum and start oral minoxidil.
Right. So ultimately, as you mentioned in one line, it has to be judged only on the patient condition, disease condition, severity. Depending upon
Yes,
that, the treatment has to be judged.
correct. Absolutely correct.
You have, sir, already mentioned about the initial shading regarding in your presentation. But if it happens, so is there any
So
particular precaution
we
to be
have to
taken?
counsel the patient that shedding will happen and you will have to accept that shedding, and that shedding will last for around 15 to 20 days, and then it will slow down and go away and you will get better quality hairs. However, if the shedding is persistent, then we also need to check the other causes, whether there is any inflammation in scalp, whether patient has any seborrheic dermatitis, whether patient has any dandruff. We need to check all those things if patient is suffering from any other conditions other than just alopecia. And if we find anything positive, then we have to treat that condition also so that the shedding does not persist for longer.
Right. Sir, in fact, along with this, you have mentioned about hirsutism and other side effects also.
Yes,
Uh, but
absolutely.
for that particularly any or maybe hypertrichosis, so any particular precautionary measures to be taken, or counseling is the only key for.
Counseling is the only key. And second thing which we need to understand is we need to, uh, you know, uh, tell our patients that if they're developing any of the side effects which can happen, immediately they contact us, and the stopping the drug at that point itself in prevents the severity of hypertrichosis also. And most of the times, like once you have done or you have stopped the oral minoxidil, after a certain point of time, the hypertrichosis which had developed reduces also, and new growth of hair does not happen in the unwanted areas.
So particularly it means it is a reversible, I will say, symptoms, maybe for
Yes,
temporary period.
correct.
Yeah. So next question is, sir, related with this. How soon the
Mhm.
benefits appear as compared to topical minoxidil? Do you find any difference that the patient treating with oral minoxidil and patient treating with topical minoxidil has a difference in benefits?
Yeah, definitely. See, the topical minoxidil absorption levels are not very specific for each individual. They vary from person to person. Whereas when we give oral minoxidil, it does not have to pass through any barriers. It directly reaches the blood flow and reaches the scalp and the area where it has to do its action. So results of oral minoxidil are comparatively better than topical minoxidil. But it's just that to take a tablet, patients are usually hesitant. That is why topical form still scores above the oral form.
Right. So in continuation with this, only one question is there, sir. Any quality of hair growth difference with the oral minoxidil as compared to topical in.
No such. Ultimately, it's minoxidil. So, as such, no such major difference in terms of quality or anything like that. The hair growth is similar to what you get in topical minoxidil. The only thing which I mentioned is here the bioavailability is comparatively higher. So, you get faster and better results as compared to topical minoxidil.
Right. So moving to the sir, next question. What according to you is the place in the therapy for oral minoxidil?
No, it has a huge place in therapy because, as I mentioned, that most of the times, you know, if the patient is not able to tolerate topical minoxidil or if they are not responding to topical minoxidil, then oral minoxidil is the only option left with us.
All right. In fact, sir, in your during your clinical practice, is there any precautionary measures to be taken before starting the low dose oral minoxidil, or you
We
do
check.
take precautionary measures?
Yes, yes, we do check their blood pressure. If their blood pressure is normal, then only we start the minoxidil. And we always get a history of cardiac diseases. We always get a history of whether they have underwent any cardiac procedures or whether they are taking any aspirin or other medications. And we discuss with patient, and if they have any history of such things, we first get their ECG done and then only proceed with the medication. So I had a young patient around 26, 27-year-old boy. He had been under anti-androgens, topical minoxidil, PRPs and everything. And he had good response for 3, 4 years. And then suddenly again his hair started thinning. So we wanted to shift him to oral minoxidil. But then we got his ECG done and ECG had minor changes. So physicians strictly advised to not shift him to oral minoxidil. So you need to take care, you will because directly minoxidil will not do something, but if patient already has some underlying condition, then oral minoxidil can aggravate that condition.
So as a precautionary need to check the cardiac parameters, maybe it is
Definitely, definitely,
advisable.
definitely.
So in continuation with that, actually you have mentioned about you had a patient who of around 26, 27-year-old. with the cardiac
Mhm.
history. But any specific age group where, sir, above that you start this oral minoxidil, low dose oral minoxidil?
No, usually we don't worry about the age because it's not an anti-androgen. So if it depends on the severity, but not below 18 years of age, definitely. But anyone who has androgenetic alopecia and who is progressing very fast and not responding to topical or wants a better result as compared to only topical, then those cases we start with oral minoxidil.
Okay. Sir, as per your clinical experience, how long you have prescribed low dose oral minoxidil?
So low dose minoxidil we have prescribed for now as long as last patient we have done is for 1.5 years. I am myself taking oral minoxidil since last 20 months on a regular basis. 1 or 2 day, usually Sundays I don't take because I'm at home, but rest Monday to Saturday I take daily. So it doesn't have any long-term side effects at 2.5 mg or 1.25 mg.
But sir, as you said that it is a you have also already taken for 20 months, or some of the patient
Yeah,
has already taken for 1 year also. So maybe
yeah.
after some time of 6 months or 7 months, is it required any tapering of dose, or it should be continuous like same as?
So if you have received or reached your desired goal, then you can taper down. So what you can do is you can make it 3 days a week, or you can make it alternate day. Uh, but you should continue. If you stop it completely, then it is the results are going to wane off. Ultimately, minoxidil is not a cure. It's just helping you improve your hair quality. So we need to understand that if we stop it completely, it's going to wash it off completely from the body, and whatever results we have achieved will start going down.
So one more question has come that as you mentioned, there are a couple of indications like androgenetic alopecia or maybe telogen
Mhm.
effluvium where it is showing a good results, maybe some cases of alopecia areata also. But apart from this, any particular indications do you have tried this low dose oral minoxidil? Maybe in traction alopecia or a chemotherapy induced alopecia, something like this?
I have not tried in other cases like alopecia areata or traction alopecia. I have mainly tried it in androgenetic alopecia only because that is the primary area where we get good results from.
Sir, in fact, these were some of the questions which has there in the chat box which I have compiled. A
Yeah,
few questions also that pop up. One of question is that nowadays, sir, there is lot of discussion going on one of the therapeutic option is JAK inhibitors.
correct,
That is the oral JAK inhibitors, tofacitinib, oral tofacitinib. So, what is
correct.
your opinion on use of this kind of approach, like oral tofacitinib as a JAK inhibitor plus topical minoxidil in particularly alopecia areata or any other?
No, it can be tried. The only benefit is oral minoxidil is going to prolong the anagen phase. So automatically it is going to increase the thickness of hair and it is going to allow the hair to grow longer. So it will help, but the primary pathology has to be addressed first.
Address.
So if your autoimmune condition has been addressed properly, and then just if you want to improve the quality of hairs which are growing from there, then oral minoxidil can definitely be added up. There is no harm in it.
Right. Sir, just wanted to ask that will it be possible to share your personal experience, maybe related with one patient, that how you have treated with this low dose oral minoxidil or any particular condition where
So
you find out an excellent result?
So we have
With
multiple patients who are on oral minoxidil. We have female patients as well as male patients. Male patients we have of all different age groups, 20 to 30 as well as 60-year-olds also, where the oral minoxidil has given good result. And all those patients who were, so I have many patients who have scalp psoriasis and androgenetic alopecia. For such patients, this is a very useful thing because they were never able to use minoxidil. Whenever they started applying topical minoxidil, within a week they had a flare up of their scalp psoriasis. So every time they used to stop minoxidil and in turn manage the scalp psoriasis. So now with oral minoxidil, what has happened? Topically, we are managing their scalp psoriasis and hair loss is managed by oral minoxidil. So that has helped a lot in such cases where patients already had some other predisposing conditions and they were not able to apply topical minoxidil. So this has helped a lot. Even in females, they were not able to apply topical minoxidil or had some or other issues. This has worked. So nowadays we also combined oral minoxidil with spironolactone or bicalutamide to work at anti-androgen level also.
Okay, so these are also combinations are oral minoxidil plus spironolactone.
Yes, yes,
Right. So means there are permutation of combination, lot of treatment options are there. Maybe
yes,
again coming to the conclusion that depending upon the patient history, severity of the disease, and the need of the hour, I think the treatment option needs to be choose.
yes, absolutely, absolutely correct.
At the last, sir, as a clinical expert, what will be your take-home messages to the audience so that they can confidently prescribe the low dose oral
So
minoxidil to their
start with low dose in a female. Start with 0.625 mg. That is half tablet of 1.25 mg. With males, you can start with 1.25 mg. The most important thing is give the dosage at night time because in the initial stages when you start oral minoxidil, patients might feel lightheadedness or headache. So if you give them during daytime, they will come back and complain to you, I'm having a lot of headache or I'm having dizziness in my scalp. I'm not feeling good after taking oral minoxidil because ultimately it is a vasodilator, so it increases blood supply to the scalp. So preferably give at night time. Tell them to take it just half an hour or 15 minutes before they are sleeping. So even if the blood flow increases to the scalp, they don't feel that headache because by the time they wake up, the minoxidil's half-life has already washed it out. Second is avoid giving this in patients who already have migraine. Okay, so that is important care which you should take and use it for 45 days. If you don't see desired results, increase the dose. Although guidelines mention 3 months, but patients are not so you know reliable and they will keep asking you every 1 month, madam kuch hua nahi, sir kuch hua nahi. So you in clinical practice we have to increase the dose faster as compared to what guidelines mention. So these are the only things which you need to take care of.
Definitely, sir. And as you mentioned, the two another things which once again recall that is counseling to the patient and seeing the history and condition. That would be, I think,
Yes,
additional this thing to be taken care and
yes,
according to the call can be taken.
definitely.
Yes. So there are, sir, no more questions. So we are at the end of this session. So once again, I take opportunity to thank you all the participants who have joined, taken the time in the afternoon and joined to listen aspects of low dose oral minoxidil and its role in trichology from the Dr. Samkit Shah's view. And special thanks to you, sir, for taking a time and guiding us on various aspects, particularly indications and how to use. And I'm sure that the participants will be definitely confident by listening your lecture that they can try and they can start at least the prescription of low dose oral minoxidil and give the benefits to their patients. So thank you
Correct.
so much for sharing us your valuable knowledge, sir,
Sure.
and
Thank you so much.
looking forward for your long-term association with Hetero Healthcare.
Done. Done.
Thank you, sir.
Thank you so much. Thank you. Thank you.